Good morning. My name is Dr. Sunny Kim, President and Founder of Progressive Rehabilitation Medicine in Cedar Rapids. We specialize in non-surgical spine and orthopedic interventions to help get you out of pain without invasive surgeries. I have here with me our famous athletic trainer, Mr. Benjamin Soy Kelly.
Yeah.
And Ben and I are going to share with you some interesting concepts about hip pain and hip problems, and some breaking news as it relates to artificial hips. So Ben, you've been working with us and helping to rehabilitate patients with hip problems. What's the most common thing that you are seeing that is affecting how people walk?
Their gait is a huge problem. So whenever you have any form of impingement or muscle atrophy or restriction in motion, anything, it can cause pain to travel up and down the chain and also just limit you in daily life. So
yeah, that's a good point. So it seems that the hip joint is one of the more difficult things to keep healthy.
Yeah.
Right? Because it's a dynamic joint. It's not like a knee joint, which is, more of a hinge joint with fewer degrees of motion. The hip joint has 360 degrees of motion.
Yeah.
So there's a lot more that can go wrong, and one of the most common things that we're seeing from a biomechanical standpoint is tightness of the hip adductors and weakness of the hip abductors, abductors. So the gluteus medius, for example, becomes deficient and weak, and then that throws the axis of the joint off.
Yeah, and also creates more motion at the low spine when walking with Trendelenburg and things like that. So
sure,
you have that pelvic tilt and all kinds of things. That's how it goes up the chain, at least. And yeah.
So it's really important to maintain good muscle balance in and around the hip and lower back to keep that joint healthy. Now, some patients they suffer from arthritis. It becomes very severe and debilitating, and they're exploring alternative options. How to deal with hip arthritis, and probably the most common thing we see happening is cortisone shots into the hip, physical therapy, oral non-steroidal anti-inflammatory medications, and joint replacements.
Yeah.
And to that, would you care to share with the audience some interesting information about hip replacements?
Well, a little earlier, Dr. Kim showed me a recent case of a firefighter who had his hip replaced, and something that was supposed to last a long time, but let's just say that artificial joint did not last. The neck of the femur, or the replaced neck, I should say, snapped in a way that it shouldn't have been able to, and I can't imagine what this patient had to go through in that process, especially after already having the replacement. I don't even know what options they have for fixing that.
Yeah, and it seemed to this defect appears to have happened in a certain type of hip replacement by a certain company.
Yeah.
Obviously there was a failure point in the metal. We're seeing other problems with metal, like metal corrosion, metallosis, leading to high levels of chromium and cobalt in the bloodstream.
As well as say metal toxicity, all that,
Yeah. So we use that as an illustration that, hip replacement or any kind of joint replacement, it's a big deal.
Yeah.
You're committing to a big deal.
Definitely, and from what I recall, some statistics from a long time ago, something like there's several major diseases like heart disease, etc., that having a joint replaced makes you 4 times more likely to have to deal with those major problems in the future. I've heard that several times before. I don't know how accurate that is, so
I
would research it. But
I think the connection there has more to do with chronic inflammation being worsened or aggravated by artificial implants, because it's not just the metal, it's also the glue, the synthetic glue, the plastic that
all the foreign bodies.
Yeah, so in some people, we're not exactly sure why, they just don't respond very well to that. Yeah, it'd be nice if there was like a specific test that you can take and say, hey, you're a great candidate for this type of hip replacement, you're a great candidate for that type of hip replacement, but we're not there yet.
Yeah, and there's so many options, it's like, how do you know what to pick?
Exactly. And that brings another question about why are there so many different types of options for joint replacement? So many different companies are manufacturing different types of hips, the new and latest and greatest designs. And I think that goes back to the whole FDA approval process. So if you meet certain basic criteria and you fulfill that, then it gets approved.
Yeah.
And so the first ones that get approved are the hardest, but then the subsequent ones become easier.
Yeah, they paved the way.
Yeah. But we know that if you tweak a design ever so slightly, maybe use a different type of alloy, maybe change the angle on the femoral neck, that changes the stress points. And unless these implants have been tested in the field, you really don't know how they're going to behave.
Yeah, exactly. So then, I'm always a fan of innovation and improvement, but also there's a chance that they haven't been properly tested compared to some of the older ones too, because there's just not enough people using them yet. That could be scary.
Could be very scary. So, I guess what's really important is if you're considering invasive joint replacement, go to the best doctors, ask good questions, ask about these news articles, and be well informed and know all your options.
Always get more than one opinion.
Always
tell that to anybody.
Yeah.
I never ever just get one opinion, even if it's your favorite doctor, the person you trust the most. I think it's good to just be aware of other options.
And that's probably the most common referral that we see is patients coming to us looking for other options. They're looking for alternatives to surgeries. And we specialize in regenerative options, and we have live seminar events coming up talking about regenerative options using PRP, autologous cell transfer therapy, and other types of technology to help avoid surgery, maybe prolong the need for surgery, or maybe even bypass the need for surgery altogether.
Yeah, exactly.
Yeah. So that's it today for Healthcare Unplugged. Stay bright and sunny. I know it's super cold out there right now. We're in sub-zero weather here in the Midwest, in Iowa, in Cedar Rapids, Iowa. And we don't want you slipping and falling, so stay. If you're indoors, stay healthy. Try to exercise indoors, strengthen those muscles, because last thing we need is for someone to slip and fall on some ice and break their hip.
Yeah.
Then you definitely need surgery.
Yeah, we don't want that.
Yeah. All right. To your health, and until next time, this is Dr. Sunny Kim with Healthcare Unplugged.